All right, welcome. Good morning. Welcome to the monthly Southside Wellness Coalition meeting. This is September's meeting. I'm going to share a few items on the screen first with the minutes from last month and the agenda. And then those of you in the room, you've got copies in front of you of last month's meeting as well as today's agenda. So let's go, of course, first start with the agenda. We'll run down and then we'll start with introductions. All right, so those of you on the Zoom should see the shared screen. So today, of course, our monthly hybrid meeting on September the 21st, starting at 10 a.m. We're going to do a review of the minutes. We're going to have a presentation by our special guest, Peter Carrington. We're going to talk about some recent events as well as some upcoming events that the coalition is involved in. Have an update from our trauma-informed community network as well as our leadership team, and then any other, of course, membership announcements today. So lots of good work happening today. All right, so that is our agenda for this morning. And again, it was sent out with the newsletter, sent out with the reminder of the meeting today. All right, so with that being said, before we move back into the minutes, let's go through our introductions. I'm going to start in the room, and then we will move to folks on the Zoom. So, Stephen, you want to start for us, and then we'll...
Sure. Stephen Wilson, been a member of the Southside Wellness Coalition for about 5 years. Also currently on the leadership team, a member of our local recovery community, resident of Mecklenburg County.
All righty.
Hey, I'm Ann Bishop. I'm a retired nurse, local citizen, past member of leadership team, but not currently, but still interested in what this group is doing.
Awesome. Welcome.
Hi, I'm Adela Angelina. I'm a retired physician who moved here and thinking of getting involved.
Awesome. Welcome. Welcome. All right. And then turning to the Zoom, I'm going to go down the list in front of me there. I'm going to start with Elena.
Hi, I'm Elena Martin. I'm the housing case manager at Tri-County.
Welcome, welcome. And then Peter.
Good morning. My name is Peter Carrington Brown, Moms in Motion, and At Home Your Way. I'm the community outreach representative for this area.
Awesome, welcome. Catherine.
Good morning, everyone. This is Catherine Maloney. I'm with Tri-County Community Action Agency. I'm also a part of the leadership team. Sorry I couldn't be there in person today, but all's good.
All right. Thank you. Denise.
Good morning. My name is Denise Smith. I'm with Tri-County Community Action Agency. I'm the Trauma Informed Care Specialist and also a Head Start Manager.
Good morning. Good morning. Liam.
Hey, good morning, everybody. My name is Liam Hudson. I am the founder and CEO of the Lean In Project, and I also have the privilege of serving as the current chair of the Southside Wellness Coalition. So thank you all for being here and excited.
Thank you. Darren.
All right, I'm going to jump in and out of video because I'm in bandwidth bad lands up in Brunswick. But my name is Darren Adams. I am the divisional outpatient, adult outpatient director at Southside. I'm also over the behavioral health nursing department as well. And I am happy to be a part of this this project. Liam, congratulations, sir.
Awesome. Thank you. Welcome, Darren. And then Brian.
Good morning, everyone. Brian Price with the University of Virginia Comprehensive Cancer Center, the Office of Diversity, Equity, and Inclusion.
Good morning. Thank you. Carla?
Good morning, everybody. I'm Carla Thomas. I'm with Health Quality Innovators. We're your Medicare quality improvement organization for the state, supporting multiple local community health promotion and prevention efforts such as this. Thank you.
Brenna?
I think Brennan had put something in the chat, Keenan, that she had to take a call.
Hey, sorry, I'm back.
Yeah, there you go.
Thank you though. Hi everyone, Brenna Lake, Population Health Manager for the Southside and Pennsylvania-Danville Health Districts.
Right, thank you, welcome, sorry. All right, thank you, Darren, for the backup. And then we have Angela.
Good morning. I'm Angela Jameson. I'm the Community Engagement and Partnerships Coordinator at the Central VA Healthcare System, part of Richmond VA, but I'm over in Massaponax and covering pretty much all of Central Virginia right now. Thank you.
Yeah, wow, you have a wonderful coverage area. Awesome, welcome.
Thank you.
Busy. And then Jay Grimes.
Good morning, Keenan. It's Jeanette Grimes. I am the community health worker with a wonderful group called Brunswick Health Ambassadors in partnership with BDH. And I'm so glad to be here today. I'm in transit, but recovery is so important. And just on the personal side, this year makes 20 years I've been supporting and advocating for people in recovery. And I also just had a Amazon bestseller called Recovery and Repurpose. So I really am excited about the work Southside Wellness is doing, because we're still out here in these get well streets. Thank you.
Awesome, thank you. Jeanette, send me that link so we can put that on our newsletter and advertise that for you. Send me the information about what you have. Thanks,
I will.
Yes, please do. Thank you.
Thank you.
All right, awesome. All right, let me double check. I got everybody. All right, so, oops, here comes Barbara. All right. Barbara, you want to introduce yourself real quick?
Hi, this is Barbara Johnson. I'm a community health worker with the Virginia Department of Health.
Right, awesome. Welcome, Barbara. Thank you for joining us. All right, so back on our agenda, you'll see that we need to look at last month's minutes. So let me bring those up. All right, back on August the 17th. All right, so again, those of you on the Zoom should see a shared screen. All right, so back on August 17th, and again, the recorded minutes as well as a copy of the recorded meeting as well as a copy of the minutes are posted on our blog on our website, bewellsouthside.org. There again, see members present in the room, members on the Zoom. Let me go ahead. Moving down. Let's see, minutes approved. Presentation by Justin Jackson, who's now a member of the leadership team from Brunswick County High School, talked about his trip with the young folks from Brunswick High School to YADAP at Longwood in July. We are supporting him in his efforts. We hope to get an update from him from the October meeting. Update from the SEED initiative. Kelly talked about, again, looking for folks to be a part of that group, engaging Halifax in South Boston. Trauma-informed care meeting. Got an update from Taquan about the team's plan for future events. Sokova's update, the summit is October 23rd. Leadership team is sending 2 representatives. Leadership team update, waiting to hear, again, that leadership team focus last month was, of course, nominating and accepting a new member to the leadership team, which we did with Mr. Jackson shortly after the meeting. And then updates on National Night Out, the Revive at SVHEC, all these upcoming events, as well as the LGBTQ Summit. So any questions, comments about the meeting minutes from last month? All right, so the floor is open for that. All right, would anyone like to make a motion to approve those minutes?
I'll make a motion. This is Catherine, to approve the minutes from last meeting.
All right, thank you so much. Can I get a second?
I'll second it.
A second, Keaton.
All right. Awesome. All right, thank you very much. All right, with that being said, I'm going to turn the floor over to Peter Carrington Brown. Peter's journey to Moms in Motion began when his mother became gravely ill during the COVID-19 crisis. She required 24-hour care upon returning home, and he quickly realized that navigating the Medicaid waiver system could be challenging and overwhelming. It was during this process that he found Moms in Motion. He was immediately impressed by the compassion, advocacy, and person-centered services of Moms in Motion. He was inspired by the organization's mission to provide quality care to individuals with disabilities and their families, and he knew that he wanted to be a part of it. So welcome, Peter. We appreciate you this morning. Please go ahead and make your presentation. Welcome.
All right. Thank you. Good morning, everyone. My name is Peter Carrington Brown, and I'm with Moms in Motion and At Home Your Way. We have two names because when we first started as Moms in Motion, and for many years after that, folks would see the name. I even did about a year ago when I was setting things up for my mom, and assume services were only for children, but they are in fact for all ages. We've been around since 2009. Our founder, oh, I went ahead there. Sorry, guys. Our founder, Carrie, has a son with special needs, and she was looking for some resources. Can you guys hear me? All right, good. I feel like I'm echoing. Okay. Carrie was looking for some resources for her son, and she came across Medicaid waivers. And as she describes it, it was like the skies opened up for her. And to know Carrie is to know a very resourceful person, an advocate mom, and she didn't stop until she got all of the answers that she was looking for. That's how our company started. She shared Medicaid waivers with, I think, over 300 families right from her kitchen table. So that's how we were born as a company. Today, we're the largest consumer-directed provider in the Commonwealth of Virginia. And I think we're right around 12,000 active clients, actually. Got to update that. So we deal with Medicaid waivers. So the two waiver programs that we deal with is the DD waiver. It's the most popular and has the most benefits and moving parts, I guess, and very desirable. Unfortunately, there's a wait list, and that wait list is determined upon need as opposed to the length of time someone is on that wait list. Our next waiver program is the CCC Plus waiver program. It's currently called the Cardinal Care program, which is a lot easier to remember. And both waivers are pretty unique for a Medicaid program in that they do not take total household income in consideration. It's solely based on that person with the disability or developmental delay. And so folks are, guys, I'm sorry, this thing's going crazy on me. So a lot of folks are surprised to find out about that because, some people see Medicaid and this, there's no way we'll qualify. It's not true with the waiver program. It's solely based on that individual that needs the assistance. So unless your kid's like a TikToker or YouTuber, chances are they're not going to price themselves out of the waiver market. The third program, that EPSDT program, A lot of acronyms in this business, I found out. It's the Early Periodic Screening Diagnostic Tool. And it lives and breathes like a waiver, but it's a tried and true Medicaid program. So they do take household income in consideration, and you already must be on Medicaid to take advantage of that particular program. So with the DD waiver program, it's an excellent program. As I mentioned, there is unfortunately quite an extensive wait list. We're trying to get that exhausted as soon as possible. We're constantly at the General Assembly building and speaking to our public servants and elected officials and trying to persuade them and invoke them to do more for the for our community that we serve. The CCC Plus or Cardinal Care Waiver, it's a little more difficult to get, but it is there's no wait list. You can just get right on there. So it's a great option for someone on that DD wait list. It's not a requisite. Some people just go straight into the CCC Plus Cardinal Care Waiver and start services. So when they're screening someone for the CCC Plus, they're taking in account a person's need or need for assistance with an ADL. It's an activity of daily living. And that could be feeding, clothing, dressing, toileting, and whatnot. And when they come out to make an assessment, they want to see what types of assistance are needed for any given ADL. Assistance can be as prominent as doing the particular motion for that or the activity for that individual, or it could be more nuanced, like prompting or reminding, observing when someone's perhaps in the shower or in the bath, just to make sure they don't turn the water on too hot, or hey Johnny, did you wash behind your ears? And so that's considered assisting as well, any type of prompting or reminding. So they need three. They need to cover three categories of activities of daily living, and also a medical nursing need. The medical nursing need can be something as pronounced as a feeding tube or breathing tube, and could be more nuanced, like the inability to self-assess, the inability to sense danger, people who wander off, and also people who cannot maintain their own medication schedule for any number of reasons. So you need the three ADL assistants, and you need the one medical nursing need. That's for the Cardinal Care CCC Plus program. As far as getting screened for these programs, for the DD waiver, people will call the local CSB board and get an appointment. They'll go to the office and they'll go through what's called a VIDES assessment. And it's just a tool that's used to kind of see where someone's at, their abilities and inabilities, and just really gauge what types of supports that individual needs. But the CCC Plus waiver, if it's an adult, it's social services that'll come out to the house, or the health department that comes out to the house and does the screening. So typically what that looks like is an RN and a caseworker from either DSS or DOH. With the EPSDT program, there's this infamous form called the DMAT-7. They don't make things simple. So that goes right to your primary care physician. They fill it out, and we get a really good success rate on folks getting that program, simply because the provider knows that individual, right? They have a depth of knowledge about their medical history. They know that family, and it's a very warm contact, hopefully. And so we get a pretty good success rate on approvals with that. We get approvals on all, and but again, with that DD wait list, that's just something that has to be worked on. I can say this: Governor Youngkin, irregardless of your politics, I beg your pardon, he's an adamant fighter for those with disabilities in the Commonwealth of Virginia, and that's just really, really refreshing. I came down here about 1.5 years ago from New Jersey. I'm a retired state trooper, and I was on Homeland Security for a few years. And but I came down to take care of Mom, and I realized real quick that getting services wasn't the easiest thing to do, especially coming from the New York metropolitan area. There's services everywhere and money to do things. And not the same here. It's getting better. We have some really great organizations, both public and private, that are always advocating for people's rights and more needs. But Governor Youngkin has pledged to exhaust that list by the end of his term. It's not just election talk. He has actually been very active in the fight. I've been in the room with him. I've observed him beyond the politician's mask. And again, irregardless of your politics, I'm apolitical, but it's just really refreshing to see him leading the charge on the state level. So when you first call Moms in Motion, you'll speak to a family resource specialist. I beg your pardon. That was the person I spoke to when I came down a year and a half ago for Mom. And I had called probably 5 different companies that handle consumer-directed services. Probably got 3 different versions of Medicaid waivers, and I was just really, really confused. And it was so frustrating. And well, when I got on the line with the family resource specialist at Moms in Motion, she broke everything down in very simple terms. And I always like to say in a way that an ex-cop from New Jersey can easily understand. And she really just demystified waivers and just listened to me. I guess a half hour of it was just kind of letting me vent my frustrations, and she was just fantastic. So I fell in love with the company, just flat out. I started following them on Facebook and going to some events. They recruited me, so here I sit. So I'm new to the space, but I am ironclad, passionate about the advocacy that this company does and that I do. I live and breathe it. I really do. I love what I do. So that family resource specialist will take an individual through a mock waiver screening coaching. And simply put, they'll just speak to the family or individual about what's going to be asked, basically question by question, when someone comes out to screen them. And a lot of families find that extremely helpful. It's an invaluable service that we offer. And by the way, our clients never see a bill from us. None of the services that we provide, we bill for. We bill directly to Medicaid for anything that we do. So they'll go through that mock waiver screening coaching, and they'll talk about some questions that may seem like they have a simple yes or no answer, because that's how they're scripted on the DMAS form. And the screener just has to go by that script, and they're not allowed to prompt, tell me more, about Johnny's, bathing, or how he has to eat, or if he needs to be watched. This thing is going crazy, guys. I'm so sorry. Okay, we'll get it right. And so we always tell families to really just explain exactly what's going on. That screener may have 5 or 6 clients that day, but that's your time, and it's your time to just really tell the story of what's going on with your loved one in your home. And we just prep them, and we set them up for success for when those screeners come out to talk with them. Once a program is selected, one of the 3 programs that are selected, they'll be ushered over to the client engagement specialist. That's how I started with Moms in Motion. And basically, a client engagement specialist, they will do the bulk of the work during the application process. They'll get them set up with the screening agency. They'll help them collect documents and get documents from physicians if we need to after we get a release. And we tell our clients right up front, listen, first of all, it's going to be 6 to 8 weeks. It is. I'm so sorry. What's going on here? It is a Medicaid program, so it does take time, but we'll be with you, every step of the way. And we're not another thing for you to do. We want to take the pressure off your shoulders and really step in and step up on your behalf. The only thing we do ask is communication, that they stay in touch and they do their part. There's a little work that they have to do. Not a lot, but we guide them with them every step of the way. So they help with that paperwork and demystify Medicaid waivers and decrease stress and confusion. And it's just a really, really good, it's a really good time for clients, because there is a kind of a waiting period. And we stay in touch with them weekly, either by phone, text, or email. So it's really, it's really neat that we're able to do that. Once a client is screened and hopefully approved, what will happen is there will be paperwork sent out to them via mail. We don't task the families with getting that over to us. We either call the doctor for the EPSDT program, social services or health department for the CCC plus waiver, and of course the CSB for the DD waiver. We just do everything we can to make their path smoother. And so we have a really good relationship with those entities that I mentioned, and you know, it's usually spot on. It just really kind of hangs on the amount of time it takes to get them screened. Sometimes these agencies are backed up and have a pretty huge caseload, and it's understandable. But again, we just walk with them step by step and take them through everything that they need to know. So once they have once we have the approval, we'll set them up for a proper intake. One of our service facilitators or case managers, synonymous, and they'll go out to the home and ask a few questions about what's going on with them. They'll kind of go over all the screening tools that were submitted in paperwork, and they'll ask, has there been anything that's changed in the last month, or do you feel that there's some other services or supports that might be beneficial to your family member? And what's really important is they go over all of the paperwork to make sure all the spellings are correct. Dates of birth, social security numbers, believe it or not, it happens quite often that there's a digit missing or incorrect, or a middle initial is left out. And that just delays the process once it's sent to Medicaid and DMAS. And so we want to avoid that. So we kind of go over all that paper with them before submitting what we submit. Okay, so upon getting approved for a Medicaid waiver, you have two options for in-home caregiver services. You can go with agency directed. I'm going to call ABC caregivers in Richmond, and they're going to come out and staff the hours that we're approved for this waiver. Or you can go with consumer directed, and that's what we deal with exclusively. That means a family or an individual has control over what goes on, who they choose who selects, they choose who comes in and out of their house to take care of them or their loved ones. And oftentimes the loved one or family friend who's already taken care of that individual now qualifies to be paid to do so. So with a consumer directed model, you need three roles that have to be in place. And that's the first one is an EOR. The EOR is a non-paid position, and they're kind of the boss and kind of like the CEO, because Medicaid looks at the family now as an agency or an entity. And that EOR has the ability to hire and let go care attendants. But their primary function is really just to go into that web portal after hours have been submitted by the caregiver, push play, get them approved so they get paid. Your next position is your caregiver or primary caregiver. That's going to be the one that's going to be with that individual most of the time and billing for most of the hours. And then they ask for a backup person. It's always been there in the language of waiver requirements for consumer direct, but it really got enforced for obvious reasons during COVID, because a lot of people had to separate and isolate themselves from family members because they've tested or been exposed. So that EOR person, that primary caregiver, and that backup caregiver, those are the three main people that we need to have in place prior to starting consumer directed services. So we start talking about that really in the early stages, even back, when you're just getting waiver coaching and stuff. They go over all that. The pay rate is $12.90 an hour. Please excuse me. Is it's $12.70 an hour. And that's basically throughout most of the Commonwealth. In the DC suburbs in Nova, it bumps up to like $16 an hour because cost of living is higher. We are trying to get a rate increase. And it's just, I don't know, it's not getting through someone's head at the General Assembly building. And it's really, really frustrating. But we continue our efforts. And from what I heard, it was proposed in this last budget that was just being considered, and looks like it's not going to make the cut. But it is $12.70 an hour. And for a live-in caregiver, they enjoy a tax-free status. So there's no federal or state taxes taken out of their check. So when you go from, say it's a mom, right, taking care of their child, when you go from a blank, as my dad used to say, a blank, to now getting $1,200-1,300 every 2 weeks, it's a real game changer for a lot of people and a lot of families. And I'll tell you what, it's just an amazing program. So if you're a living caregiver, you don't get overtime. You're not capped at the amount of hours you can work, but you do not get overtime. But if it's someone that doesn't live at that address coming in to take care of that individual, so the first 40 hours is $1,270. Anything after that, up to 56 hours where they're capped, I beg your pardon, is time and a half. So it bumps up to like 19 an hour from that $1,270 rate. I think there's a ghost in my computer. So sorry, guys. So that's so their first 40 hours is straight time, and then after that it's time and a half. So they can work up to 7 days, 8 hours a day, and so they're capped at that. But the last 16 hours of it are time and a half. So that's paid care attendance. And so other things it takes care of is medications, therapies, doctor's appointments, incontinence supplies. That was a huge thing for us. Mom's a big gal. She wasn't that mobile when I got down here. She's currently bedridden, and she needs incontinence supplies. And because Mom's a big gal, we're calling all over the place and going all over the place to just to get the proper sizes and proper things that she needs for her incontinence. And it was really frustrating. But I found out that through the waiver, it's not only paid for, but it's delivered to your home once a month, right to your doorstep. So anybody over the age of 3 that's on any one of those programs and requires incontinence supplies, they qualify and they're able to get it delivered and paid for through Medicaid, which is pretty awesome. So mileage and travel reimbursement, we want to make sure that people get to the appointments that they need to get to. Sometimes a specialist or a children's hospital could be clear across the state. And we just want to make sure they get there. So if they have their own transportation, the reimbursement rate is 65 cents per mile. And if they don't, our service facilitators / caseworkers are in touch with social services or a transportation company that is contracted to provide that service for families and individuals. I've even seen in some cases, it's rare, but I've seen it where even lodging will be taken care of. But that's something that has to be done well in advance. It's a little paperwork intensive, but we help folks get it done. The next program that's it's pretty new, actually, about 4 months old. It's the HIP program, Health Insurance Premium Payment Program. And it's a really, really neat program because for those folks who are gainfully employed and have a great insurance policy through their employer, Medicaid says, hey, listen, we know that you guys have this insurance policy through your employer, and but we also know that Johnny's on a waiver. So through this HIP program, you can keep that insurance policy in first billing position. My goodness, in first billing position. And then what we'll do, Medicaid will pick up, the slack. They'll take care of some of the premiums and co-pays and stuff. And I've even seen in some cases, Medicaid paying for something that great insurance policy that they have through work won't pay for. It's not that Medicaid is that generous. It just makes sense for them, right? Business-wise. So you really step up when it comes to picking up some of those premiums and co-pays. The real winner, of course, is a family. Less money out of pocket, they're the winners. And it's a really, really neat program. A ton of paperwork. Because I'm just convinced that the government likes to make things difficult sometimes. I don't know. But it's very paperwork and document intensive. And but what we do is we go through the whole application process step by step and make sure everything is submitted right the first time so we won't have a delay. So one of the most underutilized portions of the Medicaid waivers and EPSDT program is a $5,000 per year allowance for environmental modifications and assistive technology. So for the two waiver programs, the DD waiver and the Cardinal Care waiver, it's everything you kind of see up top for the environmental modifications. And boy, do I wish I knew about that when I came down here a year and a half ago, because what we did is we expanded Mom's shower, put some shower bars up for her, got her this amazing bath chair. And so that was all out of pocket. Unfortunately, we were able to do that, but not everybody is, right? So we make sure our families know about that. We make sure they know about that. And we submit the paperwork to the managed care organizations, the Aetnas and Optima and VA Premier folks of the world. And, we just help with that process and advocate for the clients. The approval rate wasn't that great. It's getting better only because we're all over it. As a company, I'm all over it. As an individual, I have a lot of friends in the MCO business. And I tell them straight up, you guys have to do more. Like, why is this person on a waiver? And it's been so for a year or 2 years. They didn't even know about this. So like waivers are not widely known to begin with. But it's just, we're trying to get the word out on them. But like the more nuance and some of the great features of these waivers are not talked about enough. So I make it my business to talk about them. So for the EPSDT program, it's strictly for assistive technology. I always think about this one young man, 8 years old, and I don't get choked up as much anymore about it, but he was using a tablet at school and at one of his therapies and didn't have a tablet to bring home. So through this program, through the through the assistive technology stipend, we were able to get him a tablet. And it has transformed his young life. It really has. And we're just thrilled about it. And it's just what a win for him and that family. Start to finish, again, it's 6 to 8 weeks. We provide waiver coaching and all those other things you see down there. And we do all the paperwork and talk to the MCOs about things. And we get those paid care attendants set up with what's called a fiscal agent. That's just the payroll portion of it. And, they submit their apps. They submit their hours to an app or that company's web browser. 6 to 8 weeks, it takes some time, and we're with them every step of the way. And we're always constantly answering questions because inevitably there's more. Because it can be very complex. There's a lot of moving parts, and we just try to keep it simple for them and just kind of hold their hand through the whole process. So refer families to us. We set them up for success. It's kind of what we're doing today, right? Just collaborating. I speak to groups. A lot of times I speak to individuals and families with this presentation as well. And we just try to make sure everybody is an informed consumer and they have everything they need to have a successful consumer-directed experience with their Medicaid waiver. Stronger together, right? Hopefully. So our 800 number is listed up there. I did put my direct contact information in the chat. The world of consumer-directed services is really, really busy and understaffed everywhere you look. And we're the first to admit that we are doing the best we can. Sometimes we fall short. And simply because there's such an influx of applications, we're finding that a lot of folks who went with the agencies directed are not getting the service that they need because these agencies are not staffed, and that's throughout the country. And because they're not, Medicaid doesn't pay enough for folks, so it's a constant challenge for them. So they're either having to come home part or full time to take care of their loved ones. So that's when they switch over to the consumer-directed model. And I think it's just growing and more in popularity as folks get to know and learn about waivers. And so hence the influx of clients. But I've got my personal cell phone number, which is always on. And I ask that anybody you refer, they can always call me on that 804 number or shoot me an email. I have an adult son in New Jersey on the spectrum. I'm down here taking care of my mom, who's bedridden on a waiver. I know life happens right after 5 p.m. I know it happens on the weekend. So I make myself available for families, period. I got a call 2 weeks ago from parents. It was 11:35 p.m. on a Saturday night, and they actually texted me and said, "Hey, remember when you said?" And sure enough, I got on the phone with them for like a better part of 45 minutes, and got them all set up. They had a screening that Monday morning and said, "Hey, listen, Pete, we've gone through waiver coaching, but could you just go through it again because it's been 3 weeks?" And I said, "No problem at all." So I was able to do that. So I answer my phone, and I'm passionate about what I do for families, and yeah, we're just trying to make leaps and bounds in this industry. We're the largest consumer directed company, and what's really unique, two things. Well, I'm one of 5 dads and moms in motion, and so that's neat. But most of I think 86% of our employees either have had or currently have someone on one of these waiver programs. So it makes us very unique. There's not another company in the country that has that type of employee roll call, so to speak. And I think that's it. Yeah. Does anyone have any questions? And I'm sorry about being all over the place. I'm sorry about my computer hopping all over the place. I'm just coming out of a COVID fog. It's my 3rd time around for COVID. Great. And yeah, so I'm just still getting my wits about me. But does anyone have any questions? I'd be happy to answer.
Will you tell us your, you said you're willing to share your phone number and email?
Yeah.
I have access to the chat, so will you tell me what that information
Sure,
is?
sure. So my direct cell phone number is area code 804-248-2896. And my direct Moms in Motion cell phone number is 540-551-4804. I give both out because we have this wonderful Vonage business app. And here in Mechanicsville, in my particular community, my neighborhood, we don't have great cell service. So it's just kind of a nightmare. It's not unusual for it to be 3 o'clock in the afternoon. Phone hasn't rang once on Vonage, but I have 5 messages. So I always give out my personal cell phone number as well. My email address is Peter, P-E-T-R, Carrington Brown, 2 last names, and that's CARRINGTONBROWN, breath, at moms, plural, momsinmotion.net.
Awesome. And I'll share that in the minutes as well, Peter, and I'll specifically email that out.
Excellent.
I'll take care of what's in the chat too for you.
Appreciate it. Appreciate it.
Awesome.
So I just want to congratulate. I'm sorry.
Question. There's another question in the room.
Yes. Yes.
I just want to make sure I understand because this just sounds too good to be true. Yes.
Doesn't it?
So if somebody has private insurance, or let's say they're on Medicare and they have an insurance supplement, but they're living at home with the family basically paying out of pocket for a whole lot of these services that you described.
Mm-hmm.
They're not at the income level where they qualify for Medicaid by any means, but it's possible they could still qualify for some support.
Not just some, everything that I've talked about. It's absolutely possible. You just talked about my mom. She's on Medicaid and Medicare, and she has a pension and some money that comes in from my father's military service, and yeah, so they take that in consideration. There is a cap. I think it's right around the $2,400 level for income per month. However, Medicaid and social services has what's called a spend down program. So say they're getting $3,000 a month, right? Well, pardon me, if their mortgage is $1,200, that comes off. There's a car payment that comes off, the utilities that comes off. So it spends down to a point where it's really manageable for families. And sometimes, I beg your pardon, there's something called a patient pay. And that's kind of like a copay. My mom has one because of the money she has coming in. So hers is right around $500, which is very much so on the high end of things. But there's some nuanced things that happen with that. So I don't advise that, but I'm just telling you what families are able to offset that patient pay cost a lot of times, because say someone's approved for 56 hours per week, 8 hours a day. I mean, 7 hours. okay, Peter, you can do this, COVID brain. 7 days a week, 8 hours a day. And on top of that, I didn't mention, on top of that, there's something called respite hours. And that's 480 hours per year for someone to take advantage of. So respite says, hey, listen, you have the right to be husband, wife, an individual that needs to go out and get their hair done, maybe just need to take some respite and take a break. And so we're going to pay for that attendant to come in. Sometimes it's a babysitter that the family has a relationship with, and they'll pay for that. It doesn't cut in on the regular hours during the week. So it's 480 a year. May not sound like a lot, but inevitably, when the fiscal year is about to end in June, there are people that have hundreds of hours of respite care left. So they bill however they bill. You can bill as many hours as you want. I've seen it up to 20, 22 hours a day sometimes. So there's no law saying you can't bill 24 hours a day. But the thought is, if someone needs 24-hour a day care, they should probably be in a facility. But that couple I just talked about, they have 3 kids. The twins are special needs, and they're going a lot, and all day, all waking hours, and it's really tough on them. So we were finally able to get them some help. So they bill 18, 20 hours a day, and because it's allowed. So we tell our families, listen, use it, because if you don't use it, you're going to lose it. And so that kind of, from what I've been told, it kind of offsets. It can offset that patient responsibility every month, especially if it's a family member taking care of that individual, and they're able to bill and to kind of offset that household patient pay. So yes, he or she can absolutely qualify.
Okay. All right.
Sure.
Other questions from the room as well as on the Zoom? Any other questions?
So I just want to thank you guys for having me today. But I love the work that you guys do as an organization. It's absolutely awesome. I shared that very openly, that I'm in recovery. I was. Can I share this? Is that okay?
Yeah, sure, absolutely.
Okay, great. So I was state trooper, and then I went to Homeland Security, and I was in this horrific accident and traumatic brain injury and stuff. I just wasn't supposed to walk away from it, and so that ended my career, going through a divorce at the same time. And, they were liberally giving me pain medication, and I accepted it. And I just was a mess, and I couldn't live with that. I ended up going to like 3 or 4 doctors, which is absolutely illegal. And, I ended up getting caught for it and arrested. Arrested. State trooper and former state trooper and former Homeland Security officer. But this disease knows no boundaries. It has no respect for anybody, anywhere. And so eventually, after about a 2-year stint doing all that stuff, I got arrested. And I thank God that I did, because I wasn't going to wake up. I wasn't going to wake up one day. And they just had, the pills had such a grasp on me. And so, I ended up going to prison, because even after I was put on probation initially, I never saw a time in my life where I would not be without these pills. So even after going through a rehab and getting clean, or what I thought was clean, it just continued and continued. And so I always share this, because I'm just passionate. I was passionate as I am about Medicaid waivers and folks getting service. I'm passionate about people getting clean and sober, because I'm alive because of some of the 12-step programs and smart recovery that I've been involved in. I'm a recovery coach through a religious organization, not non-denominational. It's just a faith-based organization, and I do that for folks. And it's just a little more one-on-one intensive assistance outside of, say, a sponsor in an AA or an NA program. What we do as recovery coaches, I sponsor a gentleman in NA, but as a recovery coach, we wait for about the year mark of clean time, and then we really get into some work with them. And it's more of a holistic approach. We plug them in with counseling and just really get them set up for success, because I can tell you right now, like after you come off of those pills, it's you're in a fog for 6 to 8 months, even after you haven't taken your last one. So all that to say, I advocate for that very vigorously, and I always mention it whenever I have the chance to or the permission to. So thank you, and I would be delighted to get involved with your organization on some level moving forward. I ask for that, in fact, because I'm here for a reason, and if it weren't for my higher power and these wonderful programs that I went through, I would not be talking to you today. Period.
Thank you
So,
very much for sharing that.
Yes, ma'am. Thank you. Thank you.
Yes, welcome. And again, we are excited for you to join our efforts. We appreciate feedback, support, ideas, anything that you have to offer. And obviously also with joining the coalition, we can put your information about Moms in Motion as well as your recovery coach information. We're glad to help you spread the word across our area.
That's awesome. I really appreciate it. Thank you. Does anyone else have any questions? I always say that during one of these, inevitably folks have questions, and HIPAA rules are well in effect. So a lot of times I'll have people reaching out for me after the meetings and saying, hey, listen, this is what's going on with my mom or my dad or one of my children. And I welcome you to do that. I welcome you to do that. I'll also say that Moms in Motion is hiring. We need more people. So yeah, and so it's a great company culture, fantastic benefits, and you really get a chance to make a difference in a lot of people's lives, and we need folks. And so if anyone's interested in working completely remote, our company's been remote since 2009. And so we've had that model the whole time. So COVID wasn't that much of a change for us, other than the increased amount of waivers that came in. But it's a really, really great company culture, especially coming from law enforcement. It has a lot of, some would call it toxic masculinity. And coming from that world to a company that was created by and ran by women, boy, what a change. What a refreshing change. And yeah, so I'm kind of a unicorn, one of 5 dads in our company, but we all love what we do. So we're hiring. So if you know anybody that might be interested, please reach out to me as well.
All right, awesome. Thank you so much.
Thank you.
A wonderful presentation. And if you would like to, you don't have to, if you wanted me to share your PowerPoint as well as part of the minutes and on the blog, just send them to me.
Okay, absolutely.
The recorded version will go on the blog and it'll go out in the next newsletter.
Excellent. Thank you so much.
Thank you so much, Peter. It was wonderful.
Thanks for having me, folks. I'm sorry.
Oh, you have some comments in the chat as well.
Oh, great. Okay.
All right, awesome.
Thank you so much. Bless you. Bless you. That's awesome. Thanks.
All right, so the next item on our agenda is, of course, on August 21st, we helped to host a rapid revive at the Southern Virginia Higher Education Center. Imagine you all received the newsletter just a few days ago, actually. And there, of course, were pictures featured. We were able to train 93 people in South Boston at the SVHE Center, folks who traveled all across the region. Stephen was there as part of the outreach with that. The recovery run was this past Saturday in Occoneechee State Park. We celebrated over 40 runners. And Liam, Stephen, Rusty, Mary and Catherine all joined in as either volunteers or runners. I think it was a fantastic event. I had an absolute ball. I think a lot of other folks did as well. Just to let you know, we do have a meeting to follow up with Occoneechee State Park in the next couple of weeks. From my understanding, Chris Doss, who is the state park manager there, and his staff were absolutely thrilled with how well the race was set up, how well people understood the directions, and how happy and celebratory people were at the end of the race. Of course, it was recovery. It was the year of the peer, celebrating those who are peer support specialists, who work for us as well as other local agencies, offering help to those who are in recovery. We had a presentation by Lottie Oliver, who's one of our peer support specialists. And again, people getting an opportunity to meet and greet and talk. And of course, as you all know, I'm already in the throes of how can it be better next year? What else can we do? What can we add? I know Catherine had mentioned adding yoga. Another person had mentioned reaching out and doing some type of food trucks or some type of networking lunch. And then we've also talked about the idea of maybe of also moving it to some other healthy run locations in the catchment area, so that not necessarily just using Occoneechee State Park, but maybe using part of the Tobacco Trail and things like that. So if you have any ideas about what we could do next year to be a part of the recovery run next summer, fall / please let me know. It was, like I said, very well received. And I think there are certainly ideas about it being a yearly in-person run next year in 2024. So if you want to be involved, have ideas, please let me know. We'll be working on that process. Anybody else want to add any comments about the recovery run?
Just want to thank you and your team, Keenan, for an event well planned. I know you guys worked on that for months and months and months, so great job.
Oh, thank you. Yeah, it was a lot of fun. It was a lot of fun. I know my way around Occoneechee State Park. I can definitely tell you that. It was great. And their staff was super helpful. They were just fantastic, the state park staff. And again, appreciate all the coalition members as well, in addition to myself, that came out to help. Even, wearing the don't run over the runners flat, the little vest that we wore, all that great stuff. All right, and then the next thing, of course, coming up is our LGBTQ Summit, October 14th in Danville. I do want to share on the screen, and then I'm going to turn it over to Liam to give you more great information about it. So sharing on the screen and in the room, I've got the posters. If you guys wanted to take one and pass it, and then I have additional packets of posters. If you guys are willing to go out in the catchment area and distribute those and ask folks to hang them up. And if some of you have emailed me for those, and I'm going to get them together today, I'll be dropping them off at the locations you've requested. But all of you online, if you would like some posters to be delivered to you or mailed to you for you to post across our area, please let me know. We just received these posters early this week. So here, of course, is the event, which is at no cost, October the 14th, up at the Institute of Learning in Danville. As you all know, we're sponsoring that with the Lead-In Project, as well as Danville, Pennsylvania Community Services. And so I'm gonna stop share that. So fantastic event that's happening in just a few short weeks. Liam, do you want to tell them a little bit more about the plan for that day?
Sure. Yeah. Thank you, Keenan. We're really excited about this day. We have a lot of regional and state partners coming in, including He, She, Z, and We, if y'all are familiar with them, and Side by Side out of Richmond. They're going to do some really great youth-centered advocacy programming. Lean In is going to do some programming. Southside Behavioral Health is going to do a healthy relationship seminar, as well as they're going to partner, well, and when I say they, this part is Keenan. Keenan's going to partner with Dom at Danville, Pennsylvania Community Services to offer the full Revive training. So we will be doing a full Revive training, and Narcan will be available to adults, as well as Lean In. We'll be doing a bunch of harm reduction centered stuff. We'll be giving out free harm reduction kits to all attendees. And otherwise, we just have a lot of really exciting programming. I do just want to mention that this is geared towards youth, but we have some availability for adults as well. The summit itself is free, but if anyone you know has any sort of cost restrictions around travel to the event, we can help with scholarships and mileage reimbursement. We cannot cover lodging due to funding restrictions. but we can help with mileage and, just making sure folks are able to get there. So yeah, any questions, feel free. You're welcome. I know you guys are familiar with Keenan. You're welcome to reach out to me as well at leaninprojectva@gmail.com. Or you can scan the link on any of the posters. It should have our contact information on there. But yeah, if you're interested, we still have a few more table slots for community partners. And we are prioritizing community partners who are working with folks who may be in the LGBTQIA community. So if you work for an organization and think that you would like to have a table spot there, please reach out to either Keenan or myself so that we can make sure we get you on the list. Did I miss anything, Keenan? Oh, I can't hear you.
I could set the link to register. I know that's on our Facebook, Instagram. I know we did a blast. Ellen did a blast for us on the event last week. We'll do another blast with the updated logo, since we have many more folks joining on supporting this event. Ellen will be doing another blast in the coming days. And of course, Southside Behavioral Health as well are doing some ad blasts on Facebook and Instagram. Again, so that folks can get access to it. And I'll put the link to register as well in our monthly minutes as well, and they go out. Again, so they'll be on the coalition website as well, on the blog and on the main page. All right, awesome.
And then, sorry. Oh, just
ahead.
real quick, y'all, with the link. The links track the VPN on your computers or devices. And so if you have multiple folks in your household registering, please make sure that you access the link on separate devices, because otherwise it won't let you register twice.
Oh yeah, thank you for bringing that up. Right, because I registered on my phone. So then when you go click the link, it's going to say you already took the survey. So if you're gonna register yourself and your spouse, for example, you've got to do it on 2 different devices. And that's a good one. Yeah, we've had folks call us about that. Awesome, thank you. All right, and then the Secova Summit is coming up as well as in October. It is the 23rd. It was decided at the leadership team meeting that Liam and Stephen and myself will be attending the Secova Summit on behalf of our team on October 23rd in Roanoke. That's the one-day summit where the community coalitions of Virginia are coming together to feature good information about what is happening across the state and various coalitions. So it'll be a great opportunity for us to learn more about programs others are doing, and getting new ideas for what we can be doing in our community as well in that one-day event. All right, and then I don't have a flyer yet, but I know that I've got Sarah here working on one. Boynton Day is coming up, excuse me, Boynton Day is coming up on October the 28th. We have already reserved a no-cost nonprofit table in the town of Boynton for that large community event. If you're interested, please let me know. We would love to have coalition members come out to the table, share information about the coalition, share information about Lock and Talk, share information about all the various different trainings that we provide with the Revive and the suicide prevention classes. If you're interested, please let me know. All right. And then the other item is, and I'm glad to see Angela on here as well, is that the Southern SBCC in Alberta, their campus in Alberta, is putting together an event for November 9th connected to veteran outreach. I haven't received the flyer yet, but Angela and I both already received an invitation to set up a display at that event on November the 9th that's geared toward local veterans in our area. So Angela and her team will be there. Would love to have some coalition members join me there. That's going to be on the campus of the SV Southern Virginia Community College campus in Alberta. My understanding it's going to start around 10, end around 2. It's going to be a lunch, going to be a speaker, and my understanding it's going to be an outreach to the folks that have attended SVCC Alberta, as well as local folks who served in the military, are now veterans, inviting them back to campus, and of course, celebrating their contribution to our country. Once I have the flyer and all the information, I'll certainly send out more. But that's what I found out as of just like 2 days ago. So please put that on your calendar if you would like to join us at the Veteran Outreach on November the 9th. All right, and then let's see, I don't know if anybody's on here. A little bit of fog this morning from the Trauma Informed Community Network. I don't see Mary on here this morning. I don't want to step on any toes. I know Mary is busy. I know she's working with a conversation with an agency in Halifax about hosting the resilience movie again in Halifax, as well as doing an ACEs training with a youth services group in Halifax. I don't want to missay the name. I know she's having that conversation once I have more information from her about that, but it's going to be in November. She's planning a 2-night event with the group. It is going to be open to the public. Even though this agency is hosting it, it's going to be open to the public. As soon as, again, she and I have some more particulars on the time. I think it's going to be, I know it's going to be in the evening, like 6 to 8:30 type of thing. I'll get a flyer ready, send it out, so you all can join us in South Boston for this movie showing Resilience with the Trauma Informed Care Network. All right. And then leadership team updates, leadership team members updates.
Just want to remind everybody that the SEED initiative.
You back on mute. There you
Oh,
go.
my bad. I muted myself. The SEED initiative, also known as Engaging Halifax, is still going on. This is for anyone. It is loosely described as anyone impacted by opioid use. So that can be folks who are experiencing some substance use themselves, family members, friends, anyone impacted. And so we will be holding focus groups to learn more information about that. And, ultimately we are looking to inform some policies and procedures and some health initiatives for populations who are impacted by opioid use. So if you're interested or anybody know anyone who might be, they can contact Kelly Fike. I'll make sure Keenan has that information to put it in the notes. Anybody who is interested has to contact Kelly directly. It cannot be a referral type thing. They have to reach out and request to be a part of it, and they will be compensated for any time they spent in the focus groups. So reach out to me if you have more questions, but otherwise I'll make sure we get Kelly's info in the notes.
All right, awesome. That sounds fantastic. Thank you. All right, and then of course, under our events, I think Steve and I could say that requests for information about being Revive trained, getting a suicide prevention class, learning more about Lock and Talk has this mushroomed in the last couple of weeks. Steve and I have seen each other a lot with multiple Lock and Talks in the area, Revive trainings in the area. I just got a request yesterday to go to Halifax and next month to do over 50 people. Once I know the information about that, I'll share it out. Then I did a Safe Talk this past Tuesday for SVHEC for some high schoolers that travel to SVHEC, a group of 17 high schoolers along with some of their teachers, the Safe Talk suicide prevention class. And then Monday and Tuesday, we have an applied suicide intervention skills training at Hope Church in South Boston. That class filled up weeks ago, so we were expecting 25 folks to come. I know Liam is going to be coming on Monday to talk to them during lunch about the coalition. Always a reminder when you see those events on the newsletter that, like the leadership team, as well as other coalition members, are welcome to come to these events, because this is where we capacity build. We talk to folks about the good work that we're doing through the trainings that we provide at no cost. So always reach out or you don't have to reach out. Stephen just sometimes pops in. You're welcome to pop in, right? Actually, no need to RSVP. If you're coming to an event that we're sponsoring, I can always use the help. As Peter said, I'm looking for someone to come work with me as well. So always open to getting the extra help. It's always so wonderful when you all join me at these training events. All right, so then up and coming, of course, we're going to continue to do the virtual classes, the virtual revive, the October, November, December dates will be coming out. The virtual ACEs, we continue to do that as a statewide initiative. They're still on the calendar. And like I said, lots of folks calling in and asking about how they can get involved and setting up these events for their churches, local community centers, all kinds of great stuff. Our next meeting is on to October 19th, which we're going to ask Mr. Jackson from the YADAP group to make an update as part of his presentation. So I need to turn it to other announcements from membership. Ooh, Carla just dropped something in the chat box. Thank you, Carla. Do you want to talk about that for a minute?
Sure, you're welcome. Hi, we are trying to increase the vaccination rates of not only Medicare beneficiaries, but their caregivers and people that are around them, staff members, everybody. We're focusing on flu, pneumonia, COVID, and shingles. So feel free to use any and all of those resources. We've included some social media drop-ins if you want to steal any of those to use for your own social media promotion, to get the word out about vaccines, dispel any myths, etc.
Awesome, thank you. Uh-oh, did we just freeze? Freeze here. Something happened on here. Oh, everybody froze. We did
now.
We can hear you, Keenan.
Question for Carla.
Yeah, the screen froze, but we're glad you all are still there. All right, go ahead, Catherine. We can hear you.
Oh, no, that's what all I was saying is that we can hear you. Even though the screen froze, we could still hear you. That's
Awesome.
all.
All right, we got y'all back. It unfroze. It unfroze. Like Stephen said, I mean, as Peter said, there's a ghost in the room, I think. All right, so Carla, I'm sorry, we interrupted you a little bit.
Oh, did I freeze or was I cut off? Now I can't hear you.
I heard you, but I don't know if everybody else did. This is Catherine.
Okay.
Oh, okay, so okay, well, if you heard it, Catherine, if you heard everything she said, then I've got it recorded then.
I think it's all in the chat there. I included the link to our resources, so they're free to use to help everybody get some more information about those vaccines.
Yeah, I had a question for
Yeah, Anne has a question.
Just because those of us who are live don't have access to the chat. So, but I know you'll give it to us in the minutes, but yeah. I just wonder, Carla, do you know about availability of the new the latest COVID booster?
I work closely with a very well-connected pharmacist on our team, and it's any day. It's supposedly any day now that they'll be available. However, we're hearing, we're hearing that some of the vaccine reimbursement for pharmacies will be less than the cost of the vaccine. So it'll be interesting to see who has them, who can afford them, and where they're available. So we don't have any other information on that, but we're curious to see how many people do carry them, because it's not sounding like the reimbursement rates will cover the costs. But who knows? Things are changing all the time in that space.
Yeah. And from what I understand, it's well, could you go over the indications for the latest booster? Is it for anybody? Or is it just people with increased risk?
I don't have all of the specific details for the latest shot. I think it's open to anyone. I'm not sure if any decreased availability will be encouraging people at greater risk to get them first or not. We haven't seen any additional communication about that yet, but we will certainly be passing any information along once we hear.
All right, thank you, Carla. Thank you so
Sure.
much.
Mhm.
And I'll make sure that what you put in the chat goes into our minutes. Will be sent out to
Okay.
everybody.
Thanks. I included the link there.
Can't hear you, Keenan.
You can't hear us?
Oh, now we can.
Sorry, I gotta lean in. Sorry, I have to put my speaker. I think the owl, I think I need to get a new owl maybe. He's getting kind of cranky. Any other announcements? Anything else to share?
I'll just share this. It's a little off topic, but our mentor role model program in Halifax County, they are doing a free movie night tomorrow evening at 7 p.m. It is at it's 1927 Jeffries Boulevard in South Boston. So kids can come. They do need to be accompanied by their parents. I'll send a flyer to you, Keenan, so that if you want, you can send it out. It's a little night notice, but they'll get a free movie, free popcorn, and a free drink. And it's just bring a blanket, bring a lawn chair, whatever. And it's an outdoor movie that'll be played for everybody.
If you send that to me today, I
did already.
Oh, good.
I got it.
And I can send it to Ellen and she can put it on our Facebook and Instagram today for tomorrow.
Okay. Yep.
All right, awesome. All right, and then Angela, absolutely. Angela, would you like to review the community profile document?
Yeah,
And
that would be great. Thanks. Did you
let
want
me
me to?
yeah, let me share. Let me get you to be co-host here for just a second.
Okay.
So you can share your screen. There we go. All right. Absolutely, that'd be wonderful. Thank you.
Yeah, perfect. Can you all see that okay?
Yes, yes.
All right, wonderful. So I've been making these for all the different coalitions that I'm working with, just to give you all an idea of service members and veterans that are in your community. So this is just a population breakdown. The active duty, reserve, and guard numbers are from measuringcommunities.org. So there is a small presence, not, very large, of active duty, guard, or reserve, but that is listed here. The veteran data, that's listed, and that is from the 2020 census report. And then how many veterans are enrolled in each area, that is from a public-facing Veterans Geography of Opportunity tool, and you can kind of see links for that here at the bottom. So feel free to send this out, Keenan, if you'd like. And what I really just want to kind of point your attention to is the fact that it's about less than 50%, close to 50% of the population that is enrolled in VA healthcare, but the other 50% is not. So that really speaks to why we're partnering with coalitions and why we need your help reaching these folks. And they might not be enrolled for various reasons. It could be they're not eligible. It could be that they just don't know that they're eligible. So we're trying to spread the word on that. It could be VA stigma. We know that's existed for quite some time, and we're trying to change that. But again, just speaks to kind of that collective impact model. The more of us who are kind of doing this work, the better, to try to reach everybody. And then just kind of a fun fact was included here at the bottom of each county square here. Just your largest population of veterans, their age range. So for Brunswick County, it's a younger population, 35 to 54, Halifax, 65 to 74, and then Mecklenburg, it's pretty much 65 and on. So you can see your total of all the counties here. And if you all have any questions on any of this or want to go searching for data, if you're a nerd like me, this was super fun to put together and kind of read through all that information. There's a lot more out there, but happy to answer any questions you might have.
Right, awesome, awesome. And we're always looking for opportunities to get in front of veterans. I know we've been working with Laura Gosney, who's connected to local veterans, and she's been helping us set up some events. But anyone else as well, if you know of a location, a place where, again, we can invite, specifically target and ask local veterans to come to a presentation, Lock and Talk, Revive, anywhere, again, we can do that. Angela has been generous with information, sending us all kinds of information about the Veterans Administration. And then, so when we're tabling out in the community at our events, we have that available. But we certainly would love to start gathering groups of veterans together, as we're going to be doing on November 9th with SBCC, but we also willing to do that any other locations, restaurants, churches, anywhere that our community center, anywhere that we could invite folks to come by and get information about the services available for veterans. All right.
Awesome. Thank you.
Awesome. Thank you so much. And Brenna put an update in the chat box about the vaccine. I'll put into the minutes as well. She said, looping back to the question about the newest COVID vaccines and who they are for, CDC recommends everyone age 6 months or older get a 23-24 COVID-19 vaccine. Peter, we appreciate you. We understand your need to hop off. Thank you so much. Other member updates. The floor is still open for member updates. This is fantastic. All right. Wheels. Oops. All right. If there are no more updates, we will adjourn the meeting at 11:25. All right, we will see you guys in the community at the summit, and then see you again on October 19th here on the Zoom, or come in person and join us for some drinks and snacks. You all take care. I will follow up with all the minutes, all the information from the chat box, along with flyers and such as well. Thank you so much. Have a great day.
Thanks, everybody.
Thanks, Catherine.
Thanks.
Thanks, y'all.
Thanks.